Well, I think we've made it very clear in the urgent emergency care review the number of points in the pathway in urgent emergency care that the pharmacist can contribute. And I think it's probably one of the most underappreciated professional groups in terms of the impact they can have. So if we just start at the care pathway, so we've got things that pharmacists will be able to contribute, particularly around medicines optimization and around advanced care planning for patients, how they want to respond to exacerbations of their illness. Things that are already out there like rescue packs for those with COPD. As we get further into the urgent emergency care pathway, when we're starting to look at their consultations, if they're having face-to-face interviews with general practice, again we need to see there's good evidence of bringing pharmacists right into general practice and actually be able to take a lot of the general practice load directly from the doctors, because a lot of the issues are around medications, either side effects, dosages, changes that need to be made. So that's really important. And then we have a big role, I think, for pharmacists within the telephone consultation components of the NHS. Now that's with 111, it's with 999, and also with the services that we might offer in the future to people in the network. So we might have community nurses, we might have paramedics, we might have GPs, all of whom, as well as patients, need to speak to a pharmacist. So one of the things I think we will be very keen to see happening is pharmacists being part of a network clinical advice hub. That if the GP, let's say an out-of-hours GP, is visiting a patient and there's medications they're perhaps not so familiar with, or there's a combination of medications, or there's been a medication change, that they could talk and get advice from a pharmacist. Then we start to see the role of pharmacists actually in their own territory normally in the community, but extending what they do in terms of their direct professional roles to adding to that minor ailment services. You know, we know that the training that pharmacists have been through, you know, a year more than a nurse, a year less than a doctor, an immense amount of clinical knowledge there that the patients could receive directly. But particularly then if you go on to the minor ailment services, and obviously we've heightened the role of the pharmacist in responding to the winter pressures, but I think there's a bigger role that can be taken forward, and that needs to be seen as part of the offer we make to the public. So at the moment, the 111 phone line, only 1% of the dispositions, in other words 1% of where we send people to get their advice or treatment, is to pharmacy. It can't be that low. It must be higher than that, because the things I've already described would suggest the role of pharmacists is much greater. And then when we get actually into the hospital, clearly we've already got evidence of the importance pharmacists have in terms of the efficient delivery of care, whether it's actually around the medicines optimization, whether it's around the discharging of patients, and indeed the assessments of patients. So we're looking at those pilots now of having pharmacists in A&E departments, in medical assessment units, and in the ambulatory care services. So I think the opportunities are enormous.